And remember, this is the major protease inhibitor. Kaya pagpasok mo sa Doctor of Medicine, huwag mong kakalimutan po ang AAT. Those who will be practicing in the laboratory, who do not be surprised if one day you will receive AAT measurement. Amen? Tandaan mo ha. Anong purpose niyan ngayon? Pre-pandemic, anong purpose ng AAT? This is a marker for pulmonary emphysema and juvenile hepatic cirrhosis because those patients either has markedly decreased AAT or what? Almost deficient AAT. Alpha-fetoprotein is, this one migrates between albumin and alpha-1 globulin. Take note, migrates between albumin and alpha-1 globulin. And ano ba mga importance ng alpha-fetoprotein? First, this is increased during pregnancy, during normal pregnancy, during normal pregnancy, if the mother is actually carrying what? Twins. Ma'am, ibig sabihin lumabas sa ultrasound, twins po yung babies. Tama. Mom, if I will draw blood from that mother carrying twins, I should expect physiologic increase of alpha-fetoprotein. Yes, physiologic. If that pregnancy is normal, then alpha-fetoprotein is increased, but the pregnancy is normal, then that is physiologic increase. Ma'am, bakit siya tumaas? Kasi po, twins ang kanyang babies. Tumataas po ang alpha-fetoprotein, maternal alpha-fetoprotein, kapag twins yung babies. And that is normal increase. Kapag twins yung babies, Take note. Next. And also remember that alpha-fetoprotein is considered also as gestational marker. Why? Because this is a marker for NTD. What is that? Neural tube defect. Ano pa? This is also a marker for anencephaly. And what is anencephaly? Absence of some major portions of the brain. And anencephaly is seen in what? In the newborn or unborn child, the fetus. And what is the expected concentration of the maternal serum alpha-fetoprotein? O ano ma-realize mo? Ma'am, hindi pa nagdi-deliver ng child si mother. Pwede na malaman kung yung fetus may anencephaly. Check. May neural tube defect? Check. You just have to draw blood from the pregnant woman. And if the result is increased maternal serum alpha-fetoprotein, in-ultrasound yung patient, hindi naman twins yung babies na dala-dala ni mother. Eh bakit? Mataas pa yung alpha-fetoprotein. Naku, baka yung baby yung unborn child, ay merong ano guys, NTD or anencephaly. And do not forget, this is also gestational marker in case of what? Down syndrome. Let's say, for example, maternal serum alpha-fetoprotein was measured, then the alpha-fetoprotein was decreased. Twice done, thrice done, decreased. What's the cause? The unborn child is with Down syndrome. Trisomy 21. Kaya ang tawag mo sa alpha-fetoprotein, gestational marker. It can identify disorders before the delivery of the child. Alpha-1 acid glycoprotein is orosomucoid, and this is a unique protein. Why? This is the only protein which is migrating towards, take note na, this is the only protein which is migrating towards the cathode. No, di ba dapat ang mga proteins papunta sa anode, siya cathode because of increased negative charge. Increased negative, because of the increased positive charge of the orosomucoid. What else? And this is a transporter. Transporter for what? Progesterone. This is also transporter for progesterone. What else? Tandaan mo ang other name niya, guys. Unique ang other name niyan. Ang tawag sa kanya, orosomucoid. Okay? Baka pagdating sa exam, ma'am, sino yung orosomucoid? Kaya mo yan. That is the AAG. That is the alpha-1 acid glycoprotein. Alpha-1 anti-chymotrypsin, abbreviated alpha-1X. Ano naman, guys, si alpha-1X? This is the major transporter of PSA. The major transporter of prostate-specific antigen. Okay, take the major transporter prostate-specific antigen. Ops, ma'am, pero po baka itanong sa akin sa board exam, ma'am, is this is the only protein which is negatively charged even in acidic solution. Nako, the only protein which is negatively charged even in acid solution. That is alpha-1 acid glycoprotein. That is alpha-1 acid glycoprotein. Excellent, Ion Mayan. That is AAG. Pag sinabing, this is the only protein which is negatively charged even in acid solution. Pag acidic solution, dapat ang charge ng protein positive. Pag acidic. Ito, acid na, negative pa din. That is alpha-1 acid glycoprotein. But if that is major transporter of PSA, prostate-specific antigen, that is the anti-chymotrypsin. GC globulin is group-specific globulin, and GC globulin or group-specific component is the major transporter of cholecalciferol, and cholecalciferol is vitamin D. Kaya ang tawag sa GC globulin, vitamin D binding protein. Haptoglobin is a very important marker. Actually, this one prevents the loss of the free hemoglobin. This one actually prevents the loss of the free hemoglobin, especially during urination. And haptoglobin is a very important marker in intravascular hemolysis, such as HDN, hemolytic disease of the newborn, and hemolytic transfusion reaction. And what is the expected concentration of haptoglobin in serum? Pag merong intravascular hemolysis, decreased concentration. Take note. Ceruloplasmin. Kaya guys, noong yung mga patients na may severe COVID cases, may haptoglobin measurement. Kasi di ba na-prove yan nung yung mga patients na nagkaroon ng severe COVID-19, talagang there was intravascular hemolysis. Haptoglobin is one of the markers. Take note. And ceruloplasmin, what is the advantage of this protein? Well, this is a copper binding protein. And this is a marker for Wilson disease. Eto guys, matagal mo nang memorize si Wilson disease. Question, which organ is impaired in Wilson disease? Naku, walang mag-google search. Walang magbubuklat ng books. Board exam ngayong gabi. Kung yan ang nakasalubong mong board exam na question sa exam natin, what is your answer? Wilson disease is actually impairment of which organ? Aphrodite chain publico. Excellent. Wilson disease is liver disease. It is a form of liver disease, actually. Excellent. Including Christine Breñas. Huwag kalilimutan, guys. Wilson disease is copper binding liver disease. That is copper binding liver disease. And what is the expected concentration of ceruloplasmin in Wilson disease? Decrease, markedly decrease ceruloplasmin. Remember that Wilson disease is also characterized by Kayser-Fletcher rings, the deposition of copper into the cornea of the patient. Kayser-Fletcher rings. Alpha-2 macroglobulin is one of the largest proteins in plasma, and this one is an important marker for nephrotic syndrome. The alpha-2 macroglobulin. Bakit? Kasi si albumin, guys, pagdating sa nephrosis, there is hypoalbuminemia in nephrosis. Si alpha-2 macroglobulin in nephrosis, markedly increase in serum. 10 times increase in serum. Bakit? Kasi sa laki niya, hindi siya lalabas sa glomerulus. Kaya there is a reverse relationship between albumin and alpha-2 macroglobulin. Reverse relationship. Bakit reverse? Si albumin, hypo. Si alpha-2, hyper in nephrosis. How about beta-2 macroglobulin? Beta-2 macroglobulin, do not forget, this is controlled by the kidneys. The concentration of beta-2 microglobulin, do not forget, is controlled by the kidneys. Huwag kalilimutan yan. No? Bihira. Yan yung mga tinatawag na mga unique protein. Okay? So it is also considered as a renal marker. Ano pa tatandaan natin, guys, kay Beta-2 microglobulin. It is actually found on the surface of nucleated cells. Naku, take note of that. It is found on the surface of nucleated cells, and this is a major component of the HLA, the human leukocyte antigen. A major component of the HLA, or the human leukocyte antigen, and it is freely filtered in the glomerulus. It is definitely reabsorbed, and after reabsorption, it is completely metabolized in the renal tubules. And because of that, this is being considered as a renal marker. Transferrin is siderophilin, and transferrin is the major transporter of iron. The major transporter of iron. And transferrin prevents the loss of iron during urination. Prevents the loss of iron during urination. What else? And also take note that transferrin is the most abundant protein in the beta globulin band region. The most abundant protein in the beta globulin band region. In fact, it is 90% of the proteins present in the beta globulin band region. 90%. Ano pa tatandaan natin kay transferrin? This is also a negative APR. Also a negative APR. Why negative APR? Because, guys, in nephrotic syndrome, there is low concentration of transferrin in plasma because sumasama siya sa albumin, sumasama sa urine in cases of nephrosis. It is both albumin and transferrin in the urine of patients with nephrosis. Kaya tinawag mo rin siyang negative APR. Of course, the most popular APR is CRP. That is the most popular APR, the C-reactive protein. Guys, tandaan natin ang description ng CRP. Sinabi na sa ito nung college ka, nung third year, fourth year, uulitin ko lang. CRP, remember, nako, may tumatawag. Sorry guys for the interference. Always remember that it is normal for a healthy individual. It is normal for healthy individuals, guys, to have undetectable level of CRP. It is normal for healthy individuals to have undetectable level of CRP. Huwag kalilimutan, that is normal. Ma'am, ibig mo sabihin, pag ang CRP level ko po, 0, healthy ako, congratulations. Why? It means right now, your body is not experiencing inflammatory conditions or doesn't have any significant information. Kaya huwag mong kakalimutan yan sa exam. What is that particular protein? That if the concentration, take note, 0, that is normal. Yan lang ang protein na kapag 0 ang concentration, normal. Take note. That's very important. CRP is a marker even for myocardial infarction because myocardial infarction is characterized by inflammation and necrosis. So, ang tanong ng bayan, okay? Let us summarize the APRs. Okay? You can copy, wala yan sa book mo. Let us summarize the APRs para isa lang aaralin mo. Take note of that. Next, napapansin mo dyan sa instruction, APRs are what? Proteins. And APRs are elevated in response to inflammation, infection, injury, trauma, necrosis, even after surgery, and even stress. Sila lahat ang APRs. Ma, bakit may green yung color, yung 8? Green font. Children, katatapos lang natin i-discuss ang major lipoproteins. If ever that will be asked in your exam, which of the four major lipoproteins, is a true-blooded APR? That during inflammation, injury, necrosis, the concentration of that lipoprotein is truly increased. Naku, yan ang mga tinatawag na rare discussions. So if ever, kasi guys, let us expect licensure exam to, so dapat yung question higher. So what is our answer, children? Which is the APR? Kylo, LDL, VLDL, or HDL? 5 seconds. Kailangan may sagot ka dyan sa question na yan. Kahit hindi mo i-post yan sa chat box, kailangan mo masagot yung question na yan. Kasi that will help you gauge yourself. You have to gauge yourself. You are ready for analysis. What is the answer, people? Nakalagay dyan, elevated levels, ibig sabihin na measure mo siya. Mini-measure siya sa serum. Take note of that. What is the answer? LDL. That is the low density lipoprotein. Ma, bakit LDL? Isn't it that LDL is the most atherogenic lipoprotein? That is the target of therapy to avoid atherosclerosis. Take note of that. That's why LDL is the true-blooded APR. And isn't it that ang nakalagay dyan, elevated levels? Guys, ano ba ang significance ng HDL? Those who answered HDL, may nakikita ko mga sumagot ng HDL. Ano ba ang significance ng HDL? To say that there is atherosclerosis. The rise, the high, or the low HDL? How would we know if that patient is really with a developing atherosclerosis, high or low HDL? It is the low HDL, isn't it? Because remember that the cut point, Richmond, Luis Estolas, and Kimberly Bote, it is the low HDL. Because remember, children, that what is the cut-off concentration of HDL? 40. And which is better? Richmond, Luis Richmond, Luis na lang. That is 40, take note. And remember which is better? Higher than 40. If it is lower than 40, that is dangerous. Which is sign of atherosclerosis? Less than 40, less than 35. Less than 35. Take note, guys, less than, hindi lang 35, less than 35. Inyon, Mayan. Excellent. It is at less than 40. I said less than 35. That is the start of atherosclerosis. So it is not HDL. It is LDL. Ano po nakalagay dyan? Platelets themselves have been considered, my God, as APRs. Henry's copyright 2022, page 114. Nilagay ko pa pati paging, in fairness. Para baka may Henry's ka, babasa mo yan. Platelets themselves have been considered as what? APRs. Take note of that. Let us start the first kidney function test. The first organ function test. Let's have an introduction. What is that organ function test? Let's start with the kidney, followed by the liver. Guys, pag sinabi mong kidney function test, bago tayo mag-start dito, will you please enumerate what are the kidney function tests? Ano ang mga natatandaan mong kidney function tests? BUN, CREA, and uric acid. Francis, May, Togores, excellent. Sinabi na niya yung tatlo. BUN, creatinine, blood urea nitrogen, creatinine, and the blood uric acid. Excellent answer. Well, remember, those are the routine kidney function tests. Take note of that. Francia, May, Togores. Excellent answer. Ops. Ma, bakit silang napiling kidney function tests? Of course, there is a reason. What is the main function of the kidneys? Kasi dalawang kidneys natin. What is the main function of the kidneys? Definitely to eliminate the waste products. To eliminate the products of catabolism. And products of catabolism are considered wastes. Do not forget that. They are considered wastes. So ang tanong natin sa susunod, Ma'am, Ay ano yung mga wastes na tinatapon ng kidneys? Well, these are urea, creatinine, and uric acid. Because urea, creatinine, and uric acid are products of catabolism. Uric acid is a product of catabolism of both protein and purines. Creatinine and urea are both products of protein catabolism. Creatinine is even a product of muscle catabolism. And since there are wastes, because they are products of catabolism, ano ang rule natin? The products of catabolism should be eliminated. And what is that organ and only organ responsible for the elimination of the products of catabolism? What is the answer? Kidney. So, ang ibig mong sabihin, ma'am, the reason why we are measuring excellent kidneys, Richmond Lewis. So, the reason why we are measuring creatinine, and urea, because they are the products which are being eliminated by the kidneys. Correct. And how would we know if the kidneys are functioning well? Oh, the concentrations of the three products of catabolism should be what? Within the reference limit. Mom, how would we know if the kidneys are not functioning very well? Oh, you have to measure again the products of catabolism. Why? Because if the concentrations of the three products of catabolism are increased in plasma, ano ibig sabihin nun? Then they were not eliminated by the kidneys. And remember, the main function of the kidneys is to eliminate them. Ma'am, sino yung them? Urea, creatinine, and uric acid. Huwag mong kalilimutan yan. That's why they are the kidney function test. Because they are the products of catabolism which are being eliminated by the kidneys. Kaya mo tinawag na kidney function test. How do we measure the kidney function? We measure those that are eliminated by the kidneys as the main function of the kidneys. So, ang tanong, ma'am, ano ang main function ng kidneys? If that is elimination of waste products, so therefore, what is the main function of the kidney? How would I know that the kidney is really functioning as an excretory organ? Kasi ba ang lalim-lalim naman the main function of the kidney is to eliminate urea, creatinine, and uric acid. How would I know that the three products are eliminated? Paano ko malalaman, ma'am? Simply that the three waste products are eliminated. Ay, children, what is the main function of the kidneys? How would you know that the three products are eliminated? Naku, kung face-to-face ito, kung bukas ang camera ko, makikita niyo yung itsura ng facial expression ko. Alam ko, iniisip mo yan, ma'am, paano ko malalaman na wala na si urea, si creatinine, at si uric acid, ma'am? Paano ko malalaman yan? Kailangan mo sagutin yung tanong na, so therefore, what is the main function of the kidneys? 5, 4, 3, 2, 1. What is the answer? Alam mo yung sagot ng 4 ladies, Cabubas, Castillo, De La Cruz, that is one of the specific kidney function tests. That is one of the specific. My question is, how would we know that indeed the kidneys eliminate the waste? Paano natin malalaman yun? Therefore, what is the main function of the kidneys? Children, the main function of the kidneys is the formation of urine. Alam mo, maraming nalilito dyan. Pag-isip tayo analytically, ay oo nga. The main function of the kidneys is to eliminate the waste products. That's why kidneys are the excretory organs. So how do we eliminate the products of catabolism? How do we eliminate the BUN, the creatinine, and the uric acid? What is the answer? Formation of urine. Because the formation of urine is the only expression of the elimination of waste. Bakit tinawag siyang excretory organ? Anong ine-excrete niya? Urine. At ano ang nasa urine? Yung waste products. So, ibig sabihin, ma'am, pag may magtanong sa akin, yung neighbor ko, tanungin ako ng neighbor ko, sabi sa akin ng neighbor ko, isn't it that you are a medical technology graduate? Ano sagot mo? Aha. Isn't it that medical technology graduates are very intellectual individuals? Ano sagot mo? Not much. Because humility is the greatest tower behind the shadow of excellence. And then, ano sabi sa'yo? Neighbor, I was told I have a starting kidney disease. Sabi mo, okay, continue. Sabi sa'yo, neighbor, how would I know if I already lost both kidneys? Paano ko malalaman kung my kidneys are already non-functional? Anong sabi mo sa neighbor mo? Neighbor, remember this, ha? Let me answer first your question, reverse. The main function of the kidneys is to eliminate urine. Sabi ng neighbor mo, okay. So how would you know that your kidneys are no longer functioning? Oh my God, hindi na ako iihi. Anong sabi mo? Correct. Because that is the main function of the kidneys, to form urine. So therefore, anong ibig sabihin ng children? Mom, every time na umiihi ako, ang sasabihin ko, goodbye urea, goodbye uric acid, goodbye creatinine. Right. Kasi pag hindi ka umihi, that is kidney dysfunction. The elevated concentrations of the three products of catabolism. And guys, collectively speaking, how do we call urea, creatinine, and uric acid? Collectively speaking. In 3 letters. Anong tawag natin sa tatlong yan? Collectively speaking, NPN. Richmond, Luis, Estolas, and Tabunot, Christian Joshua. Correct. They are NPNs, non-protein nitrogenous compounds. And we will be dividing the kidney function test into 3. What are the 3 major kidney function tests? The test for glomerular filtration rate, the test for renal blood flow, and the test for tubular function. Let's start with GFR. Bakit siya nang inuna mo? Well, di ba sabi ko sa iyo, ang clinical chemistry based on hierarchy. Bakit itong inuna natin? Test for GFR. Because this is considered the best overall indicator of the level of kidney function. In short, the best kidney function test. So in short, all the tests under GFR are considered best kidney markers. Then what is the meaning of GFR, or glomerular filtration rate? It's in your book already. Anong nakalagay dyan? GFR is a measure. The measure of a substance that is not bound to protein. If the substance is not bound to protein, so it means it is soluble. Remember that. This is a measure of a substance that is not bound to protein, freely filtered by the glomerulus. Second, third, not secreted by the renal tubules. Fourth, not reabsorbed by the renal tubules. And what is the fifth? Totally excreted. In short, the analyte of interest in GFR should contain the 5 important characteristics. Ano lang daw ang pwede mong i-measure sa GFR? That substance that is soluble, freely filtered, not secreted in the kidneys, not reabsorbed by the tubules, and fifth, totally reabsorbed, totally excreted. Next question. So what are the specific GFR tests? First is the clearance. That is the specific GFR test. And when you say clearance test, removal of the substance from plasma over a fixed time. What is the unit of measurement? Milliliter per minute. And what is the relationship of clearance and plasma concentration? Inversely proportional. Kanina ko pa sinasabi yan. As clearance of a substance declines, its concentration in plasma increases. Kaya di ba sabi ko, how would you know if the kidneys are not functioning well? Hindi ko na nag-form ng urine. Naku, pag hindi ako nag-form ng urine, so there is no clearance. Yeah. And what is the concentration in plasma of the 3 NPNs? Definitely increase. Take note of that. Inversely proportional. What else? And what is the formula for computing clearance? U over P. What is that? The concentration of the substance in urine over the concentration of the same substance in plasma. So there are two samples, urine and serum. P is plasma, meaning the plasma present inside your body, times volume in milliliter, that is the volume of the urine sample, over minutes. Naku, umuulan na Lord. Tapusin mo muna yung lecture. Pag umuulan, lalong humihina ang internet dito sa Farview QC. Ops, ma'am, ilang minutes po ikinolect yung urine? Well, that is a 24-hour urine collection. So therefore, 1 hour is 60 minutes, and that is 24 hours. So 60 minutes times 24 hours, that is 1,440 minutes. So over 1,440 minutes times 1.73. What is 1.73? That is a constant value. Constant value representing the body surface area of an adult size individual. Again, that is a constant value representing the body surface area of an adult size individual. That is 1.73. Siyempre, tatanungin mo ko, sasagutin ko rin yan. Ma'am, sa adult yan. Paano pag yung age niya, wala pang 20-year-old, nasa teen pa, nasa children category pa, ma'am. What is the body surface area constant value? What is our answer? 0.17. That is 0.17. Do not forget that. What is A? That is the body surface area of the patient. Do not forget that. That is the body surface area of the patient. That is over A. Next, dalawang samples natin. So, what are the specific examples of clearance test? First is inulin clearance. This is the reference method ever since. Ma'am, bakit si inulin ang reference method? Because it has all the 5 exact characteristics of a perfect GFR analyte. Ano yun? Not bound to protein, freely filtered, not secreted in the kidneys, not reabsorbed by the renal tubules, and totally excreted. That's why it is the standard reference method. Ang tanong, is this the routine method? If we are after GFR test, this is the standard GFR test, but this is not the routine GFR test. Why? Because this inulin is an exogenous substance. Not produced in the human body. This is exogenous, meaning you have to introduce this intravenously for almost 24 hours. Otherwise, you cannot measure inulin. Take note. Kaya pala ma'am siya not secreted. Correct. It is an exogenous substance which is never produced inside the body. It has to be administered intravenously. And what is the rule? If the kidneys are truly functioning very well, if let's say 20 ml of inulin is administered, therefore 20 ml should also excrete. It should also be excreted out. Bakit? Kasi nga, this is not, take note, because this is not produced inside the body. Oops, ma, bakit hindi siya routinely measured? Because the disadvantage and the greatest disadvantage of inulin is the intravenous administration. Ma'am, are you saying, narinig niyo ba guys yung lakas ng ulan? Meron daw noise elimination itong si MacBook, pero tingnan natin. Guys, ma'am, sabi mo this is standard, but not routine. Ma'am, you mean intravenous administration is not safe? It is safe. Inulin is safe. Kaya lang, naku, napaka-tedious naman ng children. Iintayin mo pa yung 24 hours. That's why it is not routinely measured because of the intravenous administration, but it is safe. Kaya lang, very tedious. That's why it is not the routine. Anong routine method? Creatinine clearance. This is the routine method. This is the best alternate method. The creatinine clearance, excellent, Kristen Brilliance. That is the alternate. Ang tanong, ma'am, kaya ba siya napiling alternate method? It has the same 5 exact characteristics of inulin. Let us try. First, is it not bound to protein? Oh yes, that is very soluble. Creatinine is a soluble substance. Is it freely filtered by the glomerulus? Of course. Is it not secreted in the renal tubules? Not secreted? Ano answer natin? Children, remember sa boarding exam, natanong na yan dati, ang dami talaga naka-realize nung ako sinabi yan before ni Ma'am Rodriguez, nakalimutan namin. Children, yes, excellent. Richmond Luis Estolas. Ano answer ni Richmond Luis? There is secretion of creatinine in the kidneys, but minimal. Yun ang sabi ni Richmond Luis. Huwag kakalimutan yun, ha? Alam ko na. Alam mo kung face-to-face ito. Ang sama ng tingin nyo kay Richmond. Ikaw na magpe-prepare ng speech. Di ba? Guys, there is a small amount, guys, of secreted creatinine in the renal tubules. There is. Next, ma'am, sabi mo freely filtered, check. Ma'am, sabi mo not bound to protein, check. There is minimal secretion in the renal tubules, check. Is it totally excreted? Yes, it is totally excreted and never reabsorbed. It is totally excreted and never reabsorbed. Tandaan mo yan, children. Ang tanong, guys, isn't it that there is serum or plasma creatinine? Ibig sabihin, whatever is the time of the day, if a medical technologist will draw blood sample from you, definitely he or she can measure plasma or serum creatinine. That is a fact. Ang tanong, saan ang galing yung creatinine na nasa blood mo? Ang sabi sa renal physiology, there is minimal secretion of creatinine in the renal tubules. However, that creatinine secreted in the renal tubules is never reabsorbed. That is totally excreted. Hindi po siya sumasama sa blood. That is totally excreted out. Lumalabas siya sa urine. Ang tanong, saan galing yung creatinine na nasa blood na nami-measure mo 24 hours? Excellent, Inyon May Ann and Katrina Carlos. What is their answer? It's coming from the skeletal muscles. Excellent. Bakit ko kinukulit-kulit yan? Natanong yan sa boarding sa before. Sabi nila, hindi ko sabi, ha? It was just relayed to me. Kaya sabi nila, naku, tinanong daw mo yung paulit-ulit mo sinabi sa creatinine clearance. Because that is a very significant information. So, huwag mo kakalimutan yan, children. The creatinine that is minimally secreted in the kidneys, zero reabsorption. Ma'am, isang galing yung creatinine sa blood 24 hours na may measure yan, kahit anong oras, kahit anong minuto. That is the product of muscle catabolism. O baka tanungin mo pa ng malalim, ma'am, ibig mo sabihin yung product of creatine muscle catabolism, which is creatinine, never excreted. That is excreted also together with the renal, tubular, secreted creatinine. Bakit ba may natitira sa blood? Guys, hindi mo lang napapansin yun. Meron kang meron kang muscle catabolism, creatine muscle catabolism normal every day. Meron yan, hindi yan nawawala, children. May nawo-worn out tayong muscles. Continuous po yun. Sabi ni Katrina Carlos, continuous po ang muscle creatine catabolism. And that is normal. Kasi may nawo-worn out tayong muscles. Tumatanda tayo every day. So ano nakalagay dyan? Freely filtered, minimal tubular secretion, but never reabsorbed. Tandaan mo yan, guys, ha? Take note, ha? Normal plasma or serum creatinine is coming from the muscles. Take note. Production and excretion of creatinine is definitely directly related to muscle mass. That's why males have higher creatinine clearance than females. Ma'am, kailangan pa ba mag-inject ng creatinine just like inulin? Syempre hindi. Because creatinine is an endogenous substance. Si inulin, exogenous. That's why this is the best alternate. We just instruct the patient to urinate and collect the urine for 24 hours. Take note, kaya mas mataas ang muscle mass at result ng creatinine clearance sa males. What else? And Cystatin C, oh, this is the second major GFR test. So therefore, there are two major GFR tests. We have the clearance and the cystatin or the cystatin. This is a low molecular weight protein. Oh, so protein siya. Take note, ha? Number one characteristic ng GFR analyte, meron siya. Soluble. Is it freely filtered by the glomerulus? Yes. Is it not secreted in the renal tubules? Yes. Ma'am, ibig sabihin si cystatin, exogenous substance? Oh no, this is an endogenous substance. It is not secreted in the renal tubules, no? Just like creatinine, diba? Unlike creatinine, this is not secreted in the renal tubules, but it is produced by nucleated cells inside the body. Produced by nucleated cells and freely filtered, not bound to protein, not secreted in the renal tubules, but secreted outside the kidneys by the nucleated cells. Do not forget that. And what else? It is completely reabsorbed, not excreted. Ma'am, bakit siya napasama sa GFR test? Di ba GFR test dapat completely excreted, never reabsorbed. That's why this is the indirect GFR test. Naku, wag mo kakalimutan yan. This is the indirect GFR test. Therefore, the clearance is the direct GFR. Why? Because clearance, kaya tinawag na clearance, it is out and part of the urine. This is indirect GFR test. In fact, the presence of cystatin in any urine sample, naku, wag mo kalimutan yan, the presence of cystatin in any urine sample is considered what? Abnormal. That is considered abnormal. Ma'am, you mean the normal concentration of cystatin in urine, the normal concentration is 0? Of course. Children, itong tatandaan mo sa board exam. What is the only kidney function test that is never measured in normal, healthy serum? Because when you say kidney function test, it should represent the excretory nature of the organ. So, dapat yung mga markers, yung mga tests, na-measure sa urine because that is the function of the organ. Oops, merong isa. Kaya tinawag sa kanya, indirect test. Indirect GFR test because the normal concentration of this marker in the urine is 0. Pag may presence sa urine, there is renal tubular dysfunction, especially the proximal convoluted tubule. Not affected by basal mass, you don't require fasting, you don't require diet, and there is no gender variation. That's why they say this is better than the creatine test. Well, marami nagtatanong sa akin, sasagutin ko na. Ma'am, totoo ba yung nababasa namin sa internet that you are the lead author of the Philippine research on cystatin C? Ako po yun. I'm still alive. With all humility. Kasi marami nagtatanong niya, Dr. Rodriguez, is it true that you are this person? That you are the lead author of the only, hanggang sa ngayong oras lang to ha, the only Philippine research on cystatin C? Yes, yours truly and with all humility, together with Dr. Raimundo Lo of St. Luke's Medical Center, Quezon City, Professor Geraldine Dayrit of UP Manila, now connected with UP Manila, and Ma'am Susette Lumangao is now working in the USA. We are the 4 authors of the first ever, and I believe up to this day, the only Philippine research about the cystatin C, which we presented in other countries, guys. And the Abbott Philippines was our sponsor. Kaya si Abbott Philippines is included. The cystatin Abbott C reagent was included in the standardization of the cystatin C test because Abbott supported our research, and the Abbott reagent, the cystatin Abbott reagent was used for Filipino research participants. So ma'am, napatunayan mo na ang cystatin C is a better marker than creatinine. Yes, that is so true. Because remember that creatinine will only increase in plasma if one of the kidneys is impaired. So tataas lang siya sa blood, ang creatinine, ang blood creatinine mag-i-increase lang kapag yung isang kidneys mo ay sira na. But that is already acute renal failure. Whereas cystatin C, children, your kidneys both are still functioning, the cystatin C is already increased. Ano ibig sabihin na? This can identify starting renal disease. I myself, guys, is also undergoing cystatin C. Every year I have a cystatin C request. Then beses dito, Mom, big time. Hindi naman masyado. Marami nagtatanong yan. Are you the Maria Teresa Rodriguez? Yes, I am the Maria Teresa Rodriguez, lead author of that research. Hindi lang po ako ang mag-isang gumawa yan. 4 po kami niyan. Dr. Raimundo Lo, Professor Geraldine David. Dr. Raimundo Lo is the Dr. Raimundo Lo, the known immunologist in the Philippines. Yung napapanood mo na interview sa TV about the COVID-19, siya na nga yun at wala na, diba? The Dr. Raimundo Lo, okay? And Professor David and Ma'am Suzette Lumanga. That's it. Okay, kaya I would always say that this is a better marker for better than creatinine. Kaya, Mom, is it true that this is now offered in the hospitals in the Philippines? Dr. Raimundo is connected with St. Luke's Medical Center, and that's the reason why St. Luke's has the cystatin C test now. Because there was a proven research. Specimen, thank you, Lord, for that opportunity. That was a very tough research study. Mahirap siyang gawin, guys. But you see, God is good all the time. And our participants in our research, they were all diabetes mellitus patients, okay? And remember that one of the complications of DM is nephropathy. That's why these can detect starting renal diseases, especially among high-risk individuals, such as DM patients. What is the sample in our research? We use serum. No fasting, collected any time of the day. And that is the reference value. How would we know if the kidneys are not functioning well? Oh, more than 1.0 cystatin. That is sign of acute and chronic renal failure and GFR decrease. When cystatin is increased, that is GFR decrease. Okay, that's why when we presented our paper in the American Association for Clinical Chemistry and also in the PAMED, Philippine Association of Medical Technologies in USA, yan ang sinabi ko, guys, that we are so proud because we were able to conduct a study on cystatin C, which is at that time, how many years ago? 10 years ago, not yet known in the Philippines. Okay? That's it. So, ako po yun, guys. Okay? So, what are the two very important GFR tests? The clearance and the cystatin. How will you differentiate the two? There is a direct GFR and there is an indirect GFR. So what is the only sample for the cystatin C? Serum, not urine. It's difficult if you use urine sample because it will only appear in the urine sample if there is damage in the proximal convoluted tubule. And it will not happen all the time, guys. That's why we use serum sample. What else? And that ends our lecture. I hope you learned something new. I will open now my camera. I am free to open it because, thank you, Lord. Pinatapos mo yung lecture ko. Umuulan-ulan na dito, guys. So difficult if it's raining. Hindi pa dumarating yung yung glass pad. Huwag mo kakalimutan yung mga lectures natin, ha? There are 4 major lipoproteins, 2 minor lipoproteins, 2 abnormal lipoproteins. There is a floating lipoprotein that is chylomicron, but there is a floating beta lipoprotein that is abnormal. That is beta VLDL. And remember the different tolerance tests. OGTT, talbutamide, 5-hour, 2nd hour. And there is an IV galactose tolerance test for the diagnosis of glycogen storage disease. Chylomicron is never part of the lipoprotein test because it does not contribute to atherosclerosis. Phospholipid is the most abundant lipid but never measured because it is not a determining factor also for atherosclerosis. I hope you learned something new. So, yes, Katrina Carlos. So, wakas nag-on-cam na si ma'am. Di ba ganun pala na itsura ko, correct? Tinagal ko lang kasi guys, mahina talaga ang internet dito sa amin. Umulan pa ngayon. Baka hindi ko matapos yung lecture. I hope you enjoyed our lecture. You learned something new. Those are very important. Children, what is the marker for monitoring glycemic control in 2 weeks? Thank you so much for all the acknowledgement here. Ang daming 100 is over. Guys, hindi pa ako lumalabas ng Zoom. What is the only marker for glycemic control in 2 weeks? Walang mag-open ng notes. Meron akong 8 weeks. Meron 6 weeks. Matulog na tayo. Matulog na. Not glycated albumin. Nako, merong isang bago. Malakas ang feeling ko. Not HbA1c. Nako, 15AG. The 15AG. Remember the 15AG? That is 1 to 2 weeks glycemic control. Okay? Tandaan nyo. Bye. Thank you so much, Pioneer Educational Review Center and Sir Moraleta and Mama Jo and Mama Edith for staying with me. Thank you, guys. Remember the 15